Thank you so much. Hello, everybody. My name is Maya James, and this is Sarah Wagner, and we work at the library. And we are always here to help everybody in town, whether you work for the town or you live in the town, to find good information. So it's part of our job as librarians and a big part of our job. So we are sharing today a little bit about some trusted health resources, health info resources, because it's really hard to know what to trust when you're looking for information online. And that's primarily where we all turn when we're looking for information. And with health information, it's particularly important to make sure that we have the right information. So we're going to talk about how we can actually go about finding that good information. And just wanted to reiterate from the beginning that we are always here to help. So anytime you have a question about health stuff, or you're trying to find out if this is a good source to trust or not, or you're trying to find more sources of information to compare with what you've heard in one place, you can always come to the library or give us a call, and we will be happy, any librarian would be happy to sit down with you or talk with you and help you find that information from a trusted source. So now I'll turn it over to Sarah.
All right, we're going to try to share our screen here because we have a presentation, which we are happy to share out afterwards. And if maybe Liska could email it to everybody, and then you'll have the links, all the links that we go to as well. So let's see if I can make that happen.
Yeah, we'll post that on the website along with the video.
Okay. All right, so Maya introduced us. And let's see if I can, nope. Oh, there we go. So Maya did a really great introduction. We're gonna talk about some trusted sources, and there will be a few slides of that with links that we'll go through a little bit, and you guys can all take a look. And then Maya's gonna talk about the SIFT method, which is a great method for if you're not sure whether you should trust a source or not. If you're going to something on your own, it's a great way of kind of evaluating what you're looking at. We'll go through some examples, and then we're gonna have plenty of time for questions. So if you think of a question and you want to not forget it, go ahead and enter it into the chat box, and then we can come back to it later and see what you've got. Oh my goodness, I'm gonna keep doing this. So up.
Okay.
All right, so here's our first slide of trusted sources, and we actually have a very local group called the Community Workshop Series that does great computer classes. We offer them here at the library, and they offer them at other libraries. It's actually SILS students, so UNC library science students that teach them. And they have them in various topics, computer basics and other things, but they have a couple that are really great and appropriate for this topic. The first one's called Evaluating Health Information Online. And then the second one is a Health Information Online class they offer. So what we've linked to here are their, whoops, maybe I can't do it that way. Oh, that worked. It's a link to their online class for the content they provide in the class. These are like the handouts that they would give you if you went to the class, but they're freely available online. So this is the one for Evaluating Health Information Online, which is kind of what we're going to go over later. But if you forget and you kind of want a step-by-step process, this would be a great resource for you.
And can you guys see that?
Can you guys see what I'm sharing?
I can't.
I can't.
Oh.
You may need to change.
We have to change what we're sharing.
Let's see.
Yeah.
No, I don't want that. I want that. Okay, there we go. Can you see it now?
Yes.
Okay.
Sweet.
So it's just like a PDF handout that you can freely access from the links, and could take you step by step. This one goes over accuracy, authority, and then gives you some examples and talks about bias as well. And these are the ones we're going to look at later. All right, so let me go back. I wonder if I can select both.
Nope.
There we go.
Oh, really?
Maybe it'll let me go between them. Are you guys seeing the trusted sources screen again or no?
Yes,
Yes, okay. So that was the community workshop series. There's 2 linked there. The next resource is the Mayo Clinic. And the Mayo Clinic is a great kind of consumer, easy to look at, and it's got great information on general topics, kind of those things, like, do I have athlete's foot? And you can go through and look at like the symptoms, and it's going to give you some pictures as well. That's just a link to the Mayo Clinic. I'm not going to go to it because I think you guys can get to that on your own. And then the third thing here is Snopes, which is great, not just for health information, but also for fact checking any type of website. So say you came up with a health topic or something political or really anything. They are a great resource for checking the accuracy of websites. If it's a known good site, or if it's a known, like, this site isn't good, you shouldn't go to it. It does not have good information. Oh, my up buttons are now working. All right, so the next slide for trusted sources it's for NC Health Info. So this is a health information website put together by UNC, the UNC School of Health Sciences. It's a great online guide for quality health information and medical information and health services.
And can you guys see the website now?
yeah,
Cool. What I like about this website is it has a search box up at the top that you can use up here. It also has these different ways to get into the various things they provide information on. This providers and services is really helpful. If you need to find a doctor for something, maybe you need to be seen for something you haven't been seen for, and you didn't get a referral from your primary care doctor, there's a great list of physicians, and it breaks it down kind of by the different health systems over here. So if you get seen with UNC Healthcare, it's great. You can go right into theirs. So it kind of gives you links to everything rather than you having to do Google searches and finding it. It's kind of bringing everything right here for you. If we go back, the other helpful section here, that's all helpful, but I noticed this free and discounted services section. So say like you don't have dental care, or somebody you know or needs help with dental care. If you come down here, it was here before. Where did I see it? Right here, dental clinic list for North Carolina. So if you could come here. And it lists for you the different dental clinics that offer free or reduced price dental care. And there's a map, and you can go in that way as well. The other one we listed there was NC Health Info in Espanol, so they have it in Spanish as well. All right, so then our last slide of trusted resources are things that are available to you through NC Live. NC Live is a great resource for any and all topics. It is provided by the State Library of North Carolina. So whether you have a library card with us, which you should be able to as an employee, even if you live not in Chapel Hill, even if you live outside of Orange County, you can still come in and get a library card with us. But say you live in Wake County and you have your Wake County library card, you can get into NC Live with that library information. So NC Live, huge resource, lots of stuff there. Can you guys see that, the NC Live website?
yes,
If you go to the homepage, it sets you up with this search resources box, and that is going to search across all of the NC Live resources all at once. If you go into this browse databases section, then you get a nice list of different kind of topical things you can go into. And one of them is for health and wellness. So if we click on that, it's going to show us the different databases you have access to and resources you have access to for health information. Medline Plus is their most recommended, and it's a great resource. It's actually going to reroute us to Medline Plus. And Medline Plus, you could do a search here for whatever topic you wanted. Say you wanted to look into diabetes. And it's going to give you an overview and different results over on the left-hand side by topics. So you'll notice a lot of times with databases, you'll do a search and then you kind of need to refine what you're doing. And this is for anything you really do. You can do your main search and then usually look for a menu either on the left-hand side or the right-hand side. And that's going to help you refine your results either by topic or maybe by format. So if you were looking for a video specifically, you could come over here and watch a video. Whoop, went too far. And then we also have Medline Plus drugs, herbs, and supplements. So this is a guide to prescriptions and over-the-counter herbs and supplements. And then they also have Medline Plus in Espanol. So they do it in Spanish as well. So like I said, we're going to send the link to this presentation to Liska and she can email it out and you'll be able to link to all these things in there. And so I'm going to let Maya take over now.
Cool. So if you're not looking at an already trusted resource, like Medline Plus, and you want to see if the website you are looking at is reliable, then we can use something that is called the SIFT method. And you'll see, you may have heard of other methods. There's several that circle around in educational circles and library circles. And they're all great. This is one that I particularly find helpful. If you don't find it helpful, you could always ask about other methods that exist. You could ask us, you could email us, you could drop by the library and ask another librarian. But this one I'm going to share with you guys today because I think it's really helpful. So when you guys get this presentation, if you click on the link here, it'll take you to an explanation of the SIFT method, but I'm just going to talk you through it right now. So SIFT stands for Stop, Investigate the Source, Find Better Coverage, and Trace Claims. So the stop part is basically just that, stop. So whenever we're confronted with a new source of information or a new piece of information, it's always a good idea to stop and think about where is this coming from and whether or not I can trust it. So we don't want to just be blindly accepting everything that we read or hear. We want to always remember to stop and think about it. So before we go and read a new website or before we accept a new piece of information, we're going to go through these other 3 steps. We're going to investigate the source. So that means I'm going to look at who's saying this or publishing it. So if I look at the website and it says that diabetes can be completely cured by this amazing drug, and I see that the website is owned by the drug manufacturer, that's going to give me a clue that maybe this source has a bias. They may not be completely trustworthy because they're trying to sell me something. So when I see that, I know that this source may not be the best source of information, and I need to go to the next step, which is to find better coverage. And even when you see that the source is maybe reliable and you think you can probably trust it, it's still a good idea to go through all the 4 steps so that you can really double check yourself, because sometimes we can be taken in by things. But if we go through all the steps, we're less likely to accidentally fall for something. But so first we're going to investigate the source, and then we're going to find better coverage. So that means if you don't know, if you can't figure out whether the source is reliable or you want to double check it, you can go look up that same information or topic in another place that you do trust. So let's say you find a health claim online, you could go to Medline Plus and double check it and see what they say. Or you could ask your physician, or you could go to NC Health Info. You could go to any trusted source. And if you don't have a trusted source that you can go to already in mind, you can also do a general search online for that topic. So if I'm looking for diabetes medicines that work, I could do a general search for like diabetes and this medicine. And again, the librarians are always here to help you with that type of searching if you're not sure how to do it or what terms to put in, or you're not finding what you're looking for. We're always happy to help you with that. So we can help you find another website, or you can find on your own another website. You can see, okay, several different websites by several different sources are all saying the same thing. Okay, I don't necessarily know 100% sure that this is correct, but it seems a lot more likely because everybody seems to agree on the topic. And then the last step is to trace claims, quotes, and media back to the original context. So that means if I'm reading something about the claim is about this diabetes research about this drug, maybe I can find the original research study that was done. And usually they're linked in the articles themselves. So I can just click on the link and read what they're saying in the actual research study. Or if I don't understand what the research study is talking about, because I don't have a medical degree, I can ask my physician. And you could also look at if there's a quote in the article for somebody, I could go look for the original interview with that person, like the full interview, to read everything that they said, because sometimes people take quotes out of context. If there's an image or a video in that article that I'm reading or that website that I'm reading, I could go look for where that original photo came from by looking it up with a Google reverse image search, or following the links in the article, or looking up the person who made the video, and make sure that I'm getting the full context of when and where this photo was taken, or the entirety of the video, not just a clip from it. So being able to trace claims can sometimes help protect ourselves against people taking something out of context and making it seem different than what the whole entirety of the whole original claim was. So that's the basic steps of the SIFT method. I'm going to stop and think about it. I'm going to investigate the source, compare it with better coverage, and I'm going to trace the claims back to the original context. So let's look at a couple of examples. So this website, before we even go there, we can start, right? We're going to stop and think about it before we actually go to the website. This is a website about altitude sickness, this page, and the website that it's on is medicallibrary.net. Well, that really doesn't tell me anything about the source. I don't know what medicallibrary.net is. So I'm just going to click on it and see if there's information. There we go. All right, are you guys seeing the website with me? Cool. So I see that this is medicallibrary.net is called the Anti-Aging Medical Clinic by Ron Kennedy Smotherman, MD. I've never heard of them before, and I don't know if he's even a real doctor, right? Because he could say anything. I see that it was published in 2021, so that's fairly recent, but it doesn't look like a super professional website. And when I look at this article, I'm not seeing any like citations. I'm not seeing where he's getting his information from. It just looks like he's talking. So I'm wondering, how do I investigate the source? Well, one thing I can do is literally look up this dude. And so I'm going to go open a Google search, and I'm going to type in his name and see if we can find it. So we've got obviously his website, something called forpatientsafety.org, which I don't know what that is either. I see that he's written a couple of books, and
That's about it.
yeah, like there's really just not that much information about him. So I'm still not sure whether I can trust it. So that doesn't necessarily mean that this guy is not a trustworthy real doctor. It just means that I'm not going to accept it without verifying by checking other coverage first. So let's see if we could do that. So we're going to go to this step F, which was find better coverage. So we can look at the claims he's making. He says altitude sickness is a disorder caused by being at a high altitude. It occurs above 8,000 feet, a matter of oxygen pressure. At 12,000 feet, there are 40% fewer oxygen molecules. So I can start trying to verify some of this information. So it says most people can go up to 8,000 feet with minimal effects. Let's see if we can verify that with another source. So maybe I can go over to Medline Plus. There we are. Oops. Back to Medline. Oh, that's not the right Medline.
No,
How do I get back to it?
type it in again. And then come down to that one.
Thank you.
There you go.
There we go. Okay, so I'm going to search altitude sickness in Medline Plus because I know it's a good resource. And it's calling it acute mountain sickness, which sounds like the same thing, developing altitude related sickness, it says. So I'll try that one. So lower oxygen levels at high altitudes. Let's see, it's a good idea to spend a few days ascending to 9,850 feet. Click to keep reading. Let's see. Here's the symptoms, exams and tests, treatments. This is a lot more information. I should have just come here. Here's keys to preventing when one is to not climb above 8,000 feet. So that seems like, okay, what he's saying here is probably pretty accurate because it's matching up with what I saw in Medline Plus. So I can probably trust what he said. Even though I don't know really much about him. So then I can trace the claims back to the source, and that's going to be really hard to do here because he hasn't cited any information. But again, I can go to Medline Plus, and I know that they have their references listed, that they're referencing medical studies and scientific information that has been verified and peer reviewed and all that good stuff. So I know that if I were to look up these studies and if I was educated enough to understand what they said, I'd be able to verify. But because it's Medline Plus, I'm going to trust that they've translated it into everyday language accurately for me. How do I get back to the presentation? Oops.
Sorry. To
There
do
we
with my
go.
left hand.
Thank you.
No problem.
Okay, so that's one example. Let's try a second example. DHMO. Again, I have no idea what DHMO is. Right off the bat, I'm looking, it does not look like a very professional website, so I'm already a little bit suspicious.
And they've
And-
got the payment thing, right? Top
Yes.
right center. That's a big
Big
clue.
red flag that they want me to pay them stuff. They want my monies. They also have advertising, like a ton of advertising, which is another way for them to make money every time somebody looks at this website. So it seems like a little bit, less reliable maybe.
And that's surprising since it's a .org.
That's a good point, Liska. So that's why we wanted to show you this exactly, because sometimes people think, oh, a .org must be a real organization. But these days, in this day and age of the internet, literally anybody can purchase a .org. So .org no longer necessarily equates to trustworthiness, unfortunately.
Ah, darn.
I know. The only thing that can, like, it really is restricted is a .gov, because that means it comes from the government itself, and the only people who can do it are the US government. So that
Yeah, we used to
.gov
say .edu, but I mean, I guess anyone that, I mean, that doesn't necessarily, because there's some educational institutions that aren't that reliable.
Exactly, yeah. So like, some random person starts a for-profit college, they also get a .edu, but they're not necessarily reliable because they might be one of these for-profit colleges that's out to get your money without actually helping you. But .gov is always going to be a government website. And that's pretty much the only guarantee when it comes to those website endings. But let's investigate this source. So we're stopping, we're thinking about it. We're not immediately accepting anything this website says, but we're going to look up who these people are. Dihydrogen monoxide research division. So let me go over here and look it up.
You can remember how to spell it, right?
I know, right? Luckily, Google's pretty forgiving. And already like the suggested results, one of them is credibility, which makes me think that there's a lot of people who are looking up whether this is reliable or not. So that is kind of a red flag too. So dihydrogen, oh yeah, see, I spelled it wrong, but Google fixed it for me. Monoxide research division. So obviously there's the website itself. Wikipedia calls it a parody. So a parody means that it's a joke website. It's not real. Here's a LibGuide. So LibGuides are things that teachers or librarians make to help people find good information. And they also call it a hoax website, meaning again, it's a joke. Here we have another school saying that it is, let's see. Oh, this doesn't look very helpful. Let's try a different one. Yeah. Now here's Washington Post. I feel like I could probably trust Washington Post. So dihydrogen monoxide, unrecognized killer. Oh, why is there?
It's popping
There we go.
up. Yeah.
Okay. And it has all this information that is the same as what's on the website, but it says, it seems like an open and shut case until you realize that this chemical compound is plain old water, 2 hydrogen molecules bonded to 1 oxygen, or H2O, dihydrogen monoxide, which can drown you, scald you, or make you go to the bathroom. So, and then it goes on to talk about this report and the origins of that organization. And it was all the origins of a kid doing a science fair project about how gullible are we. So now we know that it was a joke website. We know that we're not going to trust anything that's on this website. We don't even need to go further with our SIFT method because it's clearly a joke website, not real. But can you imagine, you go and you're so alarmed when you see this and it says, the controversy surrounding dihydrogen monoxide has never been more widely debated, and the goal of this site is to provide an unbiased data clearinghouse and a forum for public discussion. And they're even accepting donations and money, you know, so it's a little bit alarming, really, how easily we could be drawn in just because it sounds important. They say they're unbiased. It is a .org, you know. And they even have something that says United States Environmental Assessment Center. Well, let's try looking up that one. Oops, I'm really.
It's the computer. It's not you.
Let's try that
It feels
again.
very.
It's very sensitive.
Yes, it is.
Okay, so United States Environmental Assessment Center. And not the National Center for Environmental Assessment, which is a .gov. That's the only thing I'm seeing, but it brings up again the hoax of that website, the DHMO website. And it's not, so it's not a real, it's clearly not a real center. Like the Environmental Assessment Center does not exist. So they just made it up and put it on there. So this is why checking your sources is a really great idea. Can we go back again? Okay, cool. So for time purposes, I think we can skip the last one, which is WebMD, but WebMD is a recognizable source. But I'll just mention that even when it's a recognizable source, it's a good idea to go through all of the the SIFT method, so you're still going to find other coverage, because WebMD is not necessarily 100% trustworthy, not because they're giving wrong information, but just because sometimes they give information out of context, and it's much better to trust something like Medline Plus, which will make sure to give you the correct information that you're looking for. And when in doubt, you can always check with your physician. All right, so let's talk about questions.
We'll stop sharing our screen.
I know for me, one of the big things was, that, because I do in the living healthy class, we go through kind of, how to evaluate, what you do online. And we've always relied on the whole .org, .edu, .gov, .com, just looking at that and figuring out whether something is reliable or not. So now you've done away with that for me.
Yeah, I know. Sometimes it can feel a little bit like, I can't trust anything online. And it's not that you need to live suspiciously, always being suspicious and paranoid, but it's just important to be aware, to always do that first step in the SIFT method, which is to stop and think about it, not necessarily to live your life thinking everybody is out to lie to me on the internet, but thinking I'm going to be a savvy consumer. And part of that means I'm going to make sure that I check my sources and I compare it to see what other people are saying that I trust. And I look at the original claims in context and not just accept what everybody tells me. So it can be hard to draw that line between living feeling like I can't trust anything, but I don't want people to feel like they have to be constantly suspicious, but I do want people to be vigilant.
Yeah. And you may have said earlier but how do people sign up for those 2 classes that the library students lead?
Yeah, if we're offering them here at the library, there'll be a link on our website. You can also go to their main website. It's called the Community Workshop Series, and it's the UNC SILS students that teach them. So I don't think we have any coming up. We finished a fall cycle, so there'll probably be some more in the spring. They do them kind of seasonally.
Yeah, maybe, if you know about those, let me know and I can be able to promote them. I
Sure.
think that
Cool,
would be-
yeah.
we can have them on the website and then I could just send out a general promo too. Yeah,
That's
that'd be
great, yeah.
great.
Anybody have any other questions? And the things Maya went over, it's super helpful, not just for health, but for anything. Political stuff comes to my mind a lot, or, contemporary topic issues that come up. It's always helpful to look at it with a critical eye. And that's really what we do as librarians.
Yeah.
We try to do it all
Do
the
you
time.
know where Snopes gets its money, its funding?
I don't. Off the top of
It
my
would be a
head.
good idea to go look at the website and see.
Yeah.
And not just the website, but to look up on, a lot of, if it's a nonprofit organization, which I believe it is,
Yeah.
that's all public. So you can go look at their tax records and see who's giving them money, but their website says that it's all donations funded. And this is one of the reasons why we find Snopes to be really reliable, is because it's not relying on a bunch of advertising. It's not relying on you paying them something. So they don't have to fall into sensationalism or underhanded tactics to try and sell you stuff, because they're not trying to sell us anything.
That's good to know. Yeah, that's great. Thank you.
Jackie, were you going to ask something?
I wasn't going to ask a question, but I was just going to say thank you. And this has been very helpful,
Oh, good.
because I'm always diagnosing myself, then going on the website or
Same.
going on the website and seeing, what did that doctor say? And I never really know what to look for or what to trust. And I do go to the Mayo Clinic because I
Yeah, that's a
know,
good one.
that they're a reputable clinic, but there's so much other stuff out there.
Yeah.
So this was super helpful, very
Thank
helpful.
you. I'm
And
so
how to
glad.
check FACT and all of that, very
Yeah.
helpful.
Good. Good. Yeah, I totally empathize with you because I can be a little bit of a hypochondriac. And so, and also like, I don't have the training like to really know, I think I'm a smart person, but like, I'm not a physician. So I
Yeah.
don't always understand things that the doctor says or sends me. So I'm trying to look at test results. I'm like, I have no idea what this means, So I try to Google it and it's like, I don't know, so
Yeah.
it's important to have these skills. And even sometimes the doctor will say, oh, you have XYZ thing, or I'm going to give you XYZ medicine. And I'm
Mhm.
like, but you didn't tell me anything about it really. And I only have this like 15-minute appointment and you're in a hurry, but I know I can go to Mayo Clinic or Medline Plus or whatever and find more information about that. And that's really reassuring. And also my husband is a family physician. And so he gets really tired of me asking him questions all the time. And I'll be like, Shaheen, and then he'll go, you're fine. That's how bad I am about it. But he has told me like Medline Plus is where he refers his patients to go look
Okay.
for information because it's so reliable that, even a physician is saying, yes, you should look at this for information.
Yeah. Well, thank you again. I certainly appreciate it.
Yeah, very good. And I will
Mhm.
be sending out a promo to make sure that folks know to access this, because it was just wonderful, valuable information. Really appreciate it very much.
Well, thank you so much. And we definitely want to reiterate that we are always here.
Yes.
All the library staff are trained to provide reference services. So if you ever have a question and you're not sure how to find good information to answer it, we can help you make that search.
Thank you. Thank you.
Thanks for having us.
Thank
Yes.
you.
Bye-bye.
Bye.